Welcome to the EAU podcast series, AI in Urology, From Principles to Practice. In this episode, AI in Urology Education, Professor Bhaskar Somani and Dr. Pieter De Backer discuss how artificial intelligence is shaping the way urologists learn and train. Together they explore how AI can support daily clinical practice, improve efficiency and enhance education through practical tools, while also reflecting on the challenges and responsibilities that come with integrating AI into training. Join us as we embark on this informative journey.
Hello, everybody. Thank you once again for joining to the EAU podcast. And this series is on AI in urology, from principles to practice. And our podcast today will focus on AI in urology education. I'm Professor Bhaskar Somani. I'm based in Southampton in the UK. And with me is Dr. Pieter De Backer. He's a robotic surgeon at Azorg Hospital, Alast. He's also the AI lead at Orsi Academy. And both Peter and myself are one of the 8 urologists chosen in the EAU's AI working group that was originally formed last year for AI specifically. So welcome, Peter, to this.
Well, thank you for the kind introduction as well. Very happy to be here and to be together in the AI working group.
Peter, I just want to break the ice. AI is everywhere, but for a busy urologist, what do you think AI in education actually mean in practical terms?
Yeah, so what I think it means for as us busy urologists is time gain. I think for now, where we see the first applications of AI is really winning time in the either or preparation, or when you think about education, and also getting feedback on your surgical performance, making sure that everything gets better standardized. Because let's be honest, as of today, we're not measuring enough. We try to measure, but it's a lot of manual effort. And I think what we should be doing is try and standardize more. And if there's anything that AI can do better than we as humans, is help us standardize. So I think in very practical terms, actually, that's where our education as from Orsi's Academy's point of view started, is that we started to automate surgical training assessment because it's very cumbersome to manually annotate all of the errors that you're having for surgical assessment, and it scales very poorly. Surgeons need to be out of their operating theaters, and what we now try to do is we try to use AI to automatically break down a procedure into the most important parts, and they're looking into the errors. From my side, Bhaskar, you've done a lot of work in educating people. What are the most impactful tools that you see being used for surgical education as of today?
Yeah, I think the key AI tools that shape medical and surgical education, as we all know, include the large language models for rapid knowledge synthesis. I think AI enhanced simulation platforms, as you rightly said, with real-time feedback, automated question, even Viva, for example, Viva generators for exam preparation, and finally the clinical decision support system. They're all integrated kind of learning aids, and they all help with education. Peter, if I can ask you, how is urology training specifically changing? You mentioned about training, specifically changing because of AI.
Well, I think just having started my consultancy position, I think the training itself is really useful to be augmented because of easy access to a lot of resources. We have a surgical encyclopedia in our pocket, and while we had all the knowledge before with the internet, it has never been easier with large language models, for instance, to get an in-depth understanding. Thinking about resources such as Open Evidence, Vera Health, I think there's different ones of them that have shown to be improving access to education. So this is as how we see it as of today. Because let's be honest, systems we develop today, for instance, at Orsi, they are not yet clinically available to everyone. This is only at the center for now, but we want to think about use cases that are accessible everywhere.
So, Peter, then the next question, if I can ask, if I'm a urology trainee starting tomorrow, let's say, how can I realistically use AI to improve my learning?
Yeah, so what I think helps there is we have, for instance, the EAU chatbot, where you have access to the guidelines in a very easy or smart way. I think that is very relevant. And on the other hand, you can also access the documents or the resources as I said just now. But I think it's important there to think about where these systems were trained or if they were really designed for clinical usage. I think that is the biggest threshold there. Or can we reliably trust them to provide information, and is that information peer-reviewed, or what's the level of evidence? Thinking about that, how reliable do you think AI is for clinical education?
Yeah, I think it is useful, but I agree it's not fully reliable. And there are some risks, like hallucinations, outdated or biased training data, sometimes even overconfidence. When you ask the same thing, the answers can lead to overconfidence. So I think it should always be used with a critical appraisal. And the way I would put it is trust but verify, because otherwise, if you don't verify, as you rightly say, against current guidelines or evidence, then you will get it wrong.
Yeah, I agree that we should be very cautious in checking out the roles for clinical education and the trustworthiness. We now saw the advent of automated robotics recently. There were some nice papers, for instance, coming from John Hopkins, where they try to or show that the robot can automatically do a cholecystectomy.
Yeah, that's really impressive.
Yeah, exactly. So, Bhaskar, do you think that AI will change what we will need to learn, or how will we keep up with learning if there are systems like that helping us?
Yeah, I think AI will definitely shift learning from memorization to interpretation with large language models, that provides rapid access to guidelines and evidence. Now, this also makes critical appraisal skills more important because you ultimately need to appraise those, because outputs that you get from AI can be inaccurate or sometimes biased. And while prompt engineering is emerging as a practical skill, you need to have context specific answers. So, what is the context? Otherwise, the answers will be very general and broad. But I do think that core clinical judgment still remains essential. So while AI can augment and help, you still need. So AI can inform the decision, but I don't think it can take away the responsibility. That is still down to the clinician on how to use it. To come back to you, Peter, do you think AI literacy, because you've taught in the recent AAU annual meeting in terms of the courses, do you think AI literacy should become a part of formal urology training curricula?
I think it's indispensable. I think there's no other way to do it is than by training people to use it. Because I think I could still consider myself a youngster, but the even more youngsters, they use the systems. And what we want to avoid is them using the wrong systems. We want them to use open evidence as a large language model and not ChatGPT, so to speak, unless ChatGPT is regulated for that. So I think likewise, I think we're doing good. We're going quite away with the EU already with trying to educate our members with amongst this podcast, so to speak. But I think every university should try and have a specific curriculum to specifically show the dangers. I think most systems are designed to help, but being aware of the dangers is, I think, a key part there. Thinking about these dangers, what do you think that the biggest risks are when thinking about AI for education?
For me, the biggest risk is over reliance. At some point, we'll become so reliant on AI that the trainees will just accept without critically thinking or without, having an independent thinking. If you think of the cars and the sat nav or GPS. Previously, prior to the GPS, the sat nav, some of us would have some photographic memory when you're driving, because but now you just don't, because you just switch it on and you just rely on that completely. And this is what AI can do. So over reliance is one.
Yeah.
The other thing that I think is important is issues around plagiarism and academic integrity, because that authorship blurring happens because how much is AI generated, how much is contributed by the authors. And then for me, data privacy is also a big issue because, you put the clinical information, but the platforms are not secured for that. And finally, I do think that there is a risk of de-skilling because, the reasoning and decision making goes away because you rely on AI. And so will it eventually erode clinical competency? I'm not sure. Maybe it will, because if you over rely and if you get de-skilled, then ultimately you will become like how you are in the car with the GPS. You don't know the route, you just follow that, So I think that is going to be a challenge.
That's indeed something that I'm very curious about, but also a bit, maybe a bit anxious, is if you see these automated systems arriving, and they'll be here. I think in 10 years we'll have systems that can do classical procedures, like not uncomplicated classical procedures.
Maybe even
less.
Maybe
even less. I agree. And so, how do we train people then to do the complicated parts? Because that's where the system will not be performant, but maybe in the uncomplicated parts they're better than every human. How will we deal with that? And yeah, how do you think that the education then will look like in 5 to 10 years with AI? If you think about surgical skill, so one thing is the large language models, but maybe what are your thoughts about surgical skill?
I do think that this is where AI can actually help. I think the urology education will become highly personalized. The AI can tailor the learning pathway to the individual skills and gaps of the individual. And I think the AI-driven simulation can also offer real-time feedback on technical skills and decision making. For example, digital twins and virtual patients, you can enable to do complex scenarios on the digital twin before you come on the real patients.
Agreed.
And I think the assessment will shift towards continuous data-driven competency tracking. So you're improving all the time rather than an exam at the end of the year, because an exam for assessment doesn't make you better. Whereas if it's a continuous process of data-driven tracking and making you better, I do think that this is one area where AI can really help in terms of improving the skills and personalize that training for an individual.
I agree. It's actually a nice thought. I hadn't thought about it this way, but if you think about skills reassessment, it does make sense where, like for flights, if a pilot is not flying for a long time, he first needs to go into the simulator and retrain. Likewise, if we have ways of saying, look, this step, you're not perfectly good at this step, this might be a way to sustain your skill level while still having a system help you throughout these cases. And I think it will help us go faster through the learning curve, but an integrated way. Maybe we shouldn't see it as an on-off switch.
And safer. Overall, it'll improve patient safety, I think. Peter, so ask you, you are younger than me, I think. So let's be honest. Are trainees using AI, but they're just not talking about it? Do you think everybody is using AI, but just not talking about it?
I think, as always, we don't want to admit that we don't know something, right? Because if your consultant asks you something and you don't know the answer, there's nothing more annoying than that, because you want to show the best of yourself. Likewise, if you have a difficult consultation and or in the outpatient clinic and you're struggling to find a good diagnosis, and you put it into these types of large language models, they'll help you, and it will help you find some exotic diagnosis which you haven't thought about. People are not always openly talking about it, because I've seen younger colleagues that come up with things that I think, wow, this is something I've never heard about. I would be very surprised that they would have heard about it. So I think that they are using it and not telling. And I think, does that really matter if you're doing a good thing and you're helping patients forward? I don't know. But the good thing is that if you want to know that they're using it in a safe way. And again, that brings us to the first part. I think there's ways to assess it, but I think actually it should not be considered a bad thing that you're using these technologies. But and I also don't think there is any stigma or so that to admit that you did so. But still, there is some taboo around it.
And I think that could probably go away in time, as more and more people use it, and they use it like more AI. So, for example, we know we are developing the EAU sort of AI guide, let's say, or not Kalasinabi, and maybe with these things, people can try to use it in a better way, in a safer way, in a more responsible way, let's say.
Agreed. I think that's that is again the key challenge. So we discussed surgical skill training in urology. You have any final thoughts on what we would want to add there?
Yeah, I think AI will really transform the whole urology treatment with enhanced simulators like robotic simulation, even in endourology like thoracoscopy, PCNL, that'll analyze the performance in real time. and an instant objective feedback, not waiting for subjective feedback, no bias. And I think, as you said, it'll allow to standardize the matrix, benchmark, compare the outcomes. And the other thing, let's not forget, it'll also allow remote and decentralized training. You can expand. You don't have to be centralized to a center without compromising quality. So that will be also a much bigger, let's say, advantage for the remote surgeons, for the remote trainees who are not in the center.
Very much agreed, very much. And it also, to add to that, brings us to the puzzle of telesurgery and how AI and telesurgery can actually reinforce each other. So I think this is another accelerator where we will see these two fields multiplying each other and going further.
So if I take it forward, then do you think, Peter, there will be a stage where AI will replace human surgical trainer completely?
I don't think so, because in the end, we like to talk to other humans. And there's a very personal connection to surgical training. If I think about who taught me a lot of surgery, they taught it in a strict, severe way, but it's people you admire and you appreciate profoundly. And there's a human connection in that is, I think, very difficult to achieve with a pure chatbot or an AI bot, so to speak.
They are the mentors, and you look forward to them. You look up to them. You learn from them. Like, it's not just about training. It's about personality. It's about behavior. Correct.
Yeah, it's about a way of communicating with your patients. It's not just about technical skill or knowledge. It's conveying a message. And I think this is so important. And if you have better tools to quantify what you're doing, then I think there's still this interpersonal relationship with your patient that is one of the key things in trusting, in getting trust. So that's where I think the future is a synergy, but not a complete replacement.
So, Peter, changing the track, we are both in the EAU AI, let's say, working group, which is a new group with very select people. Tell us about this new group briefly.
Yeah, so I think the initiative of this AI working group was very timely, because there's all of the different groups, YAO groups, section groups, that are doing a lot of work with AI as it's impacting our current practice. And so I think for an organization such as our European Association, it's very difficult to get a hold of all that is happening and to find the correct framework to help push this forward as an initiative. And so that's where the AI working group came to place as a tool to help structure AI efforts, not to overtake them or not to tell people what they should be doing, but to make sure that there is a good dissemination and that people know what is ongoing concerning AI in the European Association. To avoid the whole splintering, if that is even an English word, where there's a lot of fragmentation, because a lot of people are in parallel working on something. A societal thing is multimodality. It's about connecting different research sources. It's imaging compared with adding with pathology, adding with other pieces. And this is where all the sections and all the working groups and all the YAO groups, for instance, can intercollide and create a bigger picture that helps our patients forward.
Agreed.
Maybe from your end, as we're both trying to structure this together, how should the urologist or the trainees get involved?
Yeah, I think, there's so many ways of getting involved. Trainees through open collaborations and AI interest groups, because as you mentioned, the AI is a part of almost all subsections of EAU, almost all groups, and they welcome early career participation. Of course, there are a lot of research opportunities, from data annotation to clinical validation studies.
Mm-hmm.
They can contribute to educational initiatives and curriculum development with AI. And I think there are lots of multi-center projects as well. It doesn't have to come just from you, yourself, or your center. There are lots of exposure to large data sets, innovation, and impactful, collaborative research. So I think overall, there's lots of opportunities. You can reach out to so many people within the EAU, within our groups. And we always, as you know, Peter, looking for enthusiastic and young people who can contribute. So,
which is very much appreciated. Yeah.
Peter, if somebody is listening and is curious but hasn't started, what should they do this week, this hour? How can they start?
Well, I think under your leadership, we were able to also organize the first AI course at EAU in London this time ago.
Which is very well subscribed, I have to say.
Yes, indeed. It was a packed room with engaging discussions. So we try to keep it accessible and open, so that people could ask their questions, what they are lying awake from, so to speak, but also like what they are misunderstanding in the market of this AI revolution. And so that is all being recorded. So all of it is being put online, I think, as we speak. I think it should be out very soon. So I think that's an excellent resource to start with. And actually, the nice thing is that there were we had two courses, one for the basics of AI in urology, and then a second part, which is for people who already know about the topic and like want to take it forward. Also highlighted some of the big multimodal projects that the EAU is doing with Pioneer, etc. So I think these are two resources, if you're a beginner or an advanced user, that can kickstart or that can bring you up to speed. So I think that's where I would start. But do you have any other final comments for the role of AI in education?
I will just sum it up, to be honest, Peter. I think AI really, has a potential to enhance education in urology. Not just by improving access to knowledge, but personalizing the training, supporting some technical skills. And I think it does need critical thinking and clinical judgment. So you can't just rely on AI. Of course, we must be cautious against bias, over-reliance, and sometimes data accuracy, and not to forget things about privacy and academic integrity. But ultimately, I think the goal is to integrate AI in the way that augments clinicians and not de-skills them. And I think if we use it thoughtfully, it can really help train urologists into really adaptive, informed, and more reflective as urologists. And finally, it really benefits our patients because sometimes we are stuck. We can't always do the decisions on our own. So I think it will influence all aspects, starting from training to, surgical procedures, to decision making. And finally, at the end of the day, it will really help us with all aspects of our own personal journeys. I think AI is going to stay with us, Peter, and we just have to.
I also don't think we'll get rid of it.
Yeah. And we just have to embrace it in a positive and a nice way rather than in a mass way because every other person is doing it. That's the wrong way of doing it.
Agreed. I think the only way is to partner with it because it will happen. If we whether we want it or not, I think we're both in the camp that we want it. But I think we should embrace it, and I think that's a very thoughtful final message or key message. Thank you very much, Bhaskar.
Thank you, Peter. And I'd like to thank Jurgita from the EAU podcast team and to EAU and European School of Urology. And hope you enjoy this podcast, which is a series of one of the 5. So there'll be more podcasts on this topic. Thank you once again, everyone.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.